Venous drainage of upper limb. The veins of the upper limb are divided into two groups. Number one, deep veins. Number two, superficial veins. Deep veins, they are present deep to the muscles and accompany the corresponding arteries and are known as venae committents. The deep veins of the upper limb include palmar venous arch in the palm or the hand, radial vein and ulnar vein in the forearm accompanying the radial artery and ulnar artery respectively, brachial vein in the arm which accompanies the brachial artery, axillary vein in the axilla which accompanies the axillary artery. So the deep veins include palmar venous arch, radial vein, ulnar vein, brachial vein and axillary vein. The axillary vein continues as subclavian vein. Superficial veins. The superficial veins are present in the superficial fascia. The superficial veins include number one, dorsal venous arch, number two, cephalic vein, number three, basilic vein, number four, median cubital vein, number five, median antebrachial vein or median vein of forearm. Dorsal venous arch. It is a network of veins present on the dorsum of the hand which is formed by the union of dorsal digital veins. Cephalic vein. It is one of the major superficial vein. It is the preaxial vein of the upper limb. Formation. The lateral end of the dorsal venous arch continues as cephalic vein. Course. It runs in the anatomical snub box. It runs in the anatomical snub box. It runs in the anterior aspect of the forearm along the lateral margin of the forearm. It runs in the anterior aspect of the cubital fossa, and in the arm it runs in the anterior aspect of the arm along the lateral margin of biceps brachii muscle. Then it enters the groove between the deltoid and the pectoralis major. So it enters the deltopectoral groove and it pierces the clavipectoral fascia. It pierces the clavipectoral fascia and finally ends in the axillary vein. Termination. It ends by terminating in the axillary vein. Basilic vein. It is one of the major superficial vein of the upper limb. It is a post-axial vein. Formation. The medial end of the dorsal venous arch continues as basilic vein. Course. It runs along the medial margin of the dorsum of forearm. At about the middle of the forearm, it winds and it ascends on the medial margin of anterior aspect of forearm. In the cubital fossa, it runs or it is present anteriorly and it runs in the arm along the medial margin of biceps brachial muscle. In the middle of the arm, it pierces the deep fascia and finally it ascends up and ends in the brachial vein. Termination. It ends by terminating in the brachial vein. Median cubital vein. It is present in the cubital fossa. It connects the cephalic vein and the basilic vein. It runs upwards and medially. It is separated from the deep structures present in the cubital fossa by bicipital aponeurosis. It is connected to the deep vein by perforating vein. The median antebrachial vein drains into median cubital vein. Median antebrachial vein. It forms as a continuation of the palmar venous network, ascends in the middle of the anterior aspect of the forearm and finally ends by terminating in the median cubital vein. Common venous pattern found in the cubital fossa. There are two common venous patterns found in the cubital fossa. Number one, head-shaped pattern. Number two, M-shaped pattern. The head-shaped pattern is formed by cephalic vein, median cubital vein and the basilic vein. It is the most common shaped pattern. M-shaped pattern, it is formed by the cephalic vein, median cephalic vein which joins the cephalic vein, median basilic vein which joins the basilic vein and finally the basilic vein. So this is M-shaped pattern. In M-shaped pattern, usually the median cubital vein is absent. Clinical anatomy. Venae puncture in the cubital fossa. The cephalic vein, basilic vein and the median cubital vein are used for withdrawing the venous blood or for IV injections. The median cubital vein is most commonly used for withdrawing the blood or IV injections for the following reasons. Since it is connected with the cephalic and basilic vein and it sends blood, most of the blood from the cephalic vein to the basilic vein, it perfuses more blood. It is separated from the deep vein, deep structures present in the cubital fossa by bicipital aponeurosis. It is kept intact by the perforating vein which connects the median cubital vein with the deep vein of the arm. So these are the reasons why the median cubital vein is commonly used for IV injections or for withdrawing the venous blood. The cephalic vein is often preferred for hemodialysis in patients with chronic kidney failure. The basilic vein is most commonly preferred for cardiac catheterization since it's in line with the axillary vein, and also the dimension of the basilic vein increases as it ascends from the cubital fossa. Thank you.